Stephen was born in 1970. He sustained a brain injury and was admitted into Jacana in 2003. Jacana is a slow stream rehabilitation service that operates according to a nursing model of care and is primarily staffed by medical nursing and allied health staff. About 12 to 18 months after admission, Stephen was advised that his rehabilitation program would cease and that he had been assessed as eligible for discharge from Jacana. However, Jacana medical staff also determined that Stephen would require accommodation and disability support services to be available before he could be discharged back into the community. 11 years later, Stephen has been obliged to remain living at Jacana due to the absence of housing and support services in the community. So Stephen and I are going to have a conversation. And first of all, Stephen, what was life like before your accident?
Really good.
Real good? Yeah? Who were you living with?
Well, ex-girlfriend, 4 daughters.
Your ex-girlfriend and your 4 daughters? And what happened that you ended up in Jacana?
It's an overdose.
An insulin overdose. So you were diabetic type 1?
Yep.
Yep. And I know you can't remember a lot of what happened after your insulin overdose, but you talked to me about when you woke up at the Red Cliff Hospital. Who was around the bedside with you?
My mum, the girls, and my brothers.
Yeah. And when you first went to Japan, did you have lots of visitors?
2 people. Well,
2 people?
Yep.
Yeah. And they visited regularly?
Couple of times.
Couple of times, yeah. And you told me that after a while your children stopped visiting you at Jacana. Yeah. Did anyone help you try to keep in contact with your children?
No one.
No one? So you didn't have any way of maintaining contact with your 4 girls?
Joy, Gabriella,
Okay.
and Rose Baker.
They tried, but you didn't have any luck. Okay. And was there an option for you to visit your girls outside of Jacana? Could you go outside and visit them so they didn't have to come into the
No
centre?
transport.
No transport, okay. So Article 22 of the CRPD is to ensure that no person with disability is subject to arbitrary interference of his privacy, family or home. Stephen is compelled to live at Jacana on the basis of his disability. His privacy is subject to constant interference and he has no privacy from other residents or staff. Most of the areas of the institution are communal. Any other residents and indeed anyone else can enter his environment at any time. Stephen has extremely limited facilities in which to accommodate his personal possessions, and any such possessions are at risk of damage or theft. Stephen had no other choice than to reside apart from his partner and his children, as he could not access services outside of Jacana. So tell me, what's it like living at Jacana? What?
Well, then not much to do.
Not much.
Breakfast, then with the lunchtime, then
So what time do you get up in the morning?
the morning, early, 8 o'clock in the morning.
8 o'clock in the morning and you
Have shower first, breakfast, bedroom, so bed, watch TV.
So you have your shower and your breakfast and you go back to your bedroom and watch TV. Okay, so then what do you do after you watch TV?
Then 12 o'clock lunchtime.
12 o'clock's lunchtime? Do you have lunch in your room or
No.
in the dining room?
Yep.
Yeah. And after lunch, what do you do?
Bedroom, with TV.
Back to the bedroom and watch TV?
That's my whole day.
That's your whole
Yeah.
day. So you stay in your bedroom until dinner time. What time's dinner time?
12 o'clock.
5 o'clock? And after dinner, what happens?
Bedroom, with TV. That's my whole day.
That's your whole day. Okay. What time do you go to bed at night?
8 o'clock.
8 o'clock? Okay. It sounds like you've been doing a lot of the same thing for over the last 11 years. What's the highlight of your week? What's the best thing that happens in your week?
Welcome here. we have movies or pub, once, every now and again.
You go to the pub? How often do you go to the pub?
I don't even know.
Maybe once a week or?
No,
No? No?
we just up to it.
No? So, every week, you don't go to the pub every week, it's
No.
just occasionally, okay. Do you still visit your mum? I know your mum lives fairly close by. Do you visit her? She's 83, isn't she?
No,
How old is she?
84,
84. And do you get to visit her?
no,
Why is that?
she can walk.
She can't
Oh,
walk,
no.
and you don't go out to visit her ever?
Once with Carol, twice with her, with
Twice,
Carol.
twice with the carer.
He was on, once she was on, once she was,
So very rarely you see your mum. I know you go to the movies sometimes. We talk about going to the movies. Who do you go to the movies with?
Debbie, your officer.
The rec officer? Yeah. And does that happen very often?
Reaches down to work, she does.
So, yeah.
Reaches down to work.
Won't you do something with it? I know you have a very tight budget because 85%, I think it's about 85% of your pension is allocated to your accommodation at Jacana. Do you manage your own money?
No,
No? So who looks after your money for you?
by the dress.
Okay. And does the public trust give you a copy of your budget so you know where your money goes?
No,
Do you get bank statements?
No,
from the
but-
Public trust? Have you ever met a public trustee officer?
no,
Okay. How much spending money do you get a fortnight?
zilch,
A fortnight? None at all?
no,
No?
no one penny.
Not one penny? Well, Article 19 of the CRPD recognises the rights of all persons with disability to live in the community with choices equal to others, and the appropriate measures are taken to facilitate their full inclusion and participation in the community. Stephen is deprived of his human right to live in the community with equal choices to others, and has been prevented from choosing his place of residence and with whom he lives. Stephen's estate is administered under the Guardianship and Administration Act 2000. The effect of this order is that Stephen is unable to choose to live elsewhere as he has no power to use his income to secure alternative accommodation. Stephen is segregated and isolated from the community by virtue of his detention at Jacana. His segregation and isolation is based on his disability. Jacana is a residential institution that only accommodates persons with severe brain injury. Segregation on the basis of disability is inherently discriminatory. Stephen is obliged to remain at Jacana because the state of Queensland has refused or failed to provide him with accommodation, community-based accommodation or support services. So, Stephen, you said you don't do much at Jacana. There's not a lot to fill your day in. I know that there are lots of things organised that you don't always attend, but do you have access to the kitchen? Can you cook your own meals?
No,
No? Do you go grocery shopping?
not like you.
You don't, you're not allowed to go
No.
grocery shopping. What about
Good,
what
I
about,
make just the money.
what about buying clothes? Do you go and buy your own
No.
clothes? Well, where do you get your clothes from?
Family,
Family? So you don't go out clothes
No.
shopping? What about getting your hair cut?
and I'm there with it, they do it.
Who does it?
Barbie or the hairdresser.
The hairdresser? And do you go out to the hairdresser?
Come here.
She comes into your car. Okay. Do you ever get a chance to meet people who don't have acquired brain injury outside of the community? Do you know anyone outside?
No,
No? I know that you used to go for walks around the
Mm.
block. Do you still go for walks around the block?
Yep.
Do you say hi to people when you go for a walk? Yeah? Have you ever met anyone in the community that...
no,
No? Okay. Article 26 of the CRPD is about taking effective and appropriate measures to enable people with disabilities to attain and maintain maximum independence, full physical, mental, social and vocational ability, and full inclusion and participation in all aspects of life. Jacana has endeavoured to create a social life for the residents by the creation of different clubs and activities. And I know that there's Happy Hour. Do you want to tell me what Happy Hour is about?
Well, there's wine drink.
You get one drink.
Complete business, complete business jets. That's it.
You get some biscuits and a drink.
Yeah,
Yeah. What kind of a drink do you have?
baby.
A BB?
Yeah.
Yeah.
He's a bourbon and Gazer. Can't have bourbon and
Do
Gazer.
you go out to get your drink or do you have it at Jacana?
Yeah.
At Jacana. Okay. So, Jacana is an environment in which all tasks of daily living are done for Stephen and which he is prevented from performing many self-care or daily living skills. Consequently, Stephen's right to receive rehabilitation services and programs to support his full inclusion in the community and participation in all aspects of life is violated. You've lived at Jacana for over 11 years. What's it feel like? Does it feel more like a home or a hospital?
Jail. That's it. That does.
It feels like jail. Between July 2000...
We're stripped of our rights.
Restrictive of your rights. Between July 2005 up to March 2014, there have been various referrals and applications made on behalf of Stephen for community-based accommodation and support services. Each of these referrals and applications have been unsuccessful. Now, over the 11 years you've lived there, you've seen people come and go.
Yeah.
Some people have left.
Yeah.
Why do you think they've been successful and you haven't?
Family support.
Okay. So they have families to support them when they get out. Stephen has been repeatedly refused access to public housing and disability support services that would provide him with an adequate standard of living. I was recently informed by the Minister for Housing and Public Works that an offer of housing for Stephen is impacted by a number of factors, including finding a suitable property and the availability of funding from disabilities from the Department of Communities. The Minister has assured me that once funding has been allocated, the Chermside Housing Service would work to find a suitable property to meet Stephen's needs. So Stephen can't get housing until he's got funding. Stephen has been refused access to public housing for a discriminatory reason, being his disability and the consequential need that he needs support services to live in the community. Article 28 of the CRPD recognises the rights of persons with disability to an adequate standard of living for themselves and their family, including adequate food, clothing and housing. It also recognises the right to social protection programs and poverty reduction programs. Stephen's right to an adequate standard of living and social protection has been subject to ongoing violation due to his detention at Jacana and his inability to secure appropriate housing and support services that would facilitate his inclusion and participation in the community. Finally, Stephen, what would you like to see happen in the future?
Well, the Chicana
Yeah.
lives with someone else.
Where would you live?
Drop on.
Strathpines?
With them. What's saying that?
Yeah. And anything else you'd like to do once you get out there in the community?
Buggy job. Part-time.
Get a part-time job? Yeah, and you told me before that you'd like to make contact with your 4 daughters again. Yeah, make some more contact with them. Yeah. The future for Stephen is uncertain. I've been informed by the Minister of Disability Services that a joint action plan across the Department of Housing and Public Works, the Department of Communities, Child Safety and Disability Services and the Department of Health has been announced to support the transition of people out of hospitals and health services, and that Stephen's disability needs would be considered in this work. Stephen has not yet been informed about the joint action plan or how it will impact on his plan to move into the community. SUPI will continue to strongly advocate that Stephen's human rights are protected and fulfilled, and that he's provided with the same opportunities as other persons to access the full benefits of the National Insurance Scheme in New Zealand. Is there anything else before we finish you'd like to say, or are you?
I complain suicide every day, Libya.
You've what?
I complain suicide every day, Libya. Suicide.
Been complaining every day.
I complain suicide every day, Libya. Every day.
Push your money without. Well, Stephen, I'd like to thank you for telling the story. I really appreciate it. And I'm sure that the rest of the audience appreciates it. So thanks very much.